A. Cardiovascular system. 1. Keep the newborn warm. Ensure the newborn is kept in a warm environment to prevent cold stress, which can lead to increased metabolic demand and decreased oxygenation. 2. Measure the apical heart rate for 1 full minute. Accurately assess the newborn's heart rate by listening to the apical pulse for a full minute to identify abnormalities such as tachycardia or bradycardia. 3. Listen for murmurs. Heart murmurs may indicate congenital heart defects. If a murmur is heard, further assessment is needed, including measuring oxygen saturation via pulse oximetry to check for potential circulatory or respiratory issues. 4. Palpate pulses. Assess pulses in various areas, such as the brachial, femoral, and dorsalis pedis, to ensure proper circulation. 5. Assess for cyanosis. Examine the newborn's skin for signs of cyanosis, bluish tint, which can indicate inadequate oxygenation. Blanch the skin on the trunk and extremities to assess circulation. 6. Observe for cardiac distress. When feeding, monitor the newborn closely during feeding for signs of cardiac distress, such as difficulty breathing or excessive fatigue, which could indicate underlying heart conditions. B. Respiratory system. 1. Suction the airway as necessary. Use a bulb syringe for clearing the upper airway by compressing the bulb before insertion. For deeper suctioning, use a French catheter. 2. Observe for respiratory distress and hypoxemia. Monitor for abnormal breath sounds, nasal flaring, retractions, grunting, pallor, cyanosis, bradycardia, and periods of apnea lasting more than 15 seconds. These signs can indicate respiratory distress or hypoxia. 3. Administer oxygen if necessary. If oxygen saturation levels are low or the newborn shows signs of respiratory distress, administer oxygen as prescribed by the healthcare provider. C. Hepatic system. Jaundice and its timing. Normal physiological jaundice appears after the first 24 hours in full-term newborns and after 48 hours in preterm newborns. Pathological jaundice occurring earlier may indicate early red blood cell breakdown and requires immediate medical attention. 2. Monitor for physiological jaundice. This typically peaks on the 5th day of life, with indirect bilirubin levels reaching 6 to 7 milligrams per deciliter. Early feeding helps in lowering bilirubin levels. 3. Encourage early feeding. Early and frequent feeding helps stimulate the newborn's intestines, promoting the excretion of bilirubin and reducing the risk of jaundice. 4. Prevent hypothermia. Prevent chilling, as cold stress can interfere with bilirubin conjugation and excretion, exacerbating jaundice. 5. Liver storage of iron. The newborn's liver stores iron from the birthing parent for 5 to 6 months, providing essential nutrients until the infant is able to meet its iron needs through solid foods. 6. Coagulation factors and vitamin K. Newborns are at risk for hemorrhagic disorders due to immature liver function and a lack of intestinal bacteria required for synthesizing vitamin K. An intramuscular injection of vitamin K, phytonadione, is typically administered to prevent bleeding. 7. Monitor for bruising or bleeding. Handle the newborn gently and monitor for signs of bruising or bleeding, which could indicate clotting issues. 8. Meconium and stools. Observe the passage of meconium stool, which is typically passed within the first 24 hours. Any delays in stool passage in premature infants should be addressed. 9. Administer vitamin K. The newborn is often given a 0.5 to 1 milligrams dose of vitamin K intramuscularly to prevent hemorrhagic disorders. D. Renal system. 1. Immature kidney function. The newborn's kidneys are immature and cannot concentrate urine effectively. Ensure hydration and monitor for signs of dehydration. 2. Monitor weight loss. It is normal for newborns to lose 5 to 10% of their birth weight in the first week due to water loss. Weight should be regained by 10 to 14 days. 3. Monitor intake and output. Weigh diapers if necessary, as 1 gram of diaper weight equals 1 milliliters of urine. Ensure the newborn is passing at least 6 wet diapers by day 4 of life. 4. Signs of dehydration. Look for signs of dehydration, including dry mucous membranes, sunken eyes, poor skin turgor, and sunken fontanelles. E. Immune system. 1. Passive immunity from placenta and colostrum. The newborn receives immunoglobulin G, IgG from the placenta, and immunoglobulin A, IgA from colostrum, providing protection against infections. 2. Infection prevention. Strict aseptic techniques and hand hygiene should be maintained by all caregivers to prevent infections. 3. Monitor temperature. Keep track of the newborn's temperature to ensure it remains stable. 4. Eye medication and cord care. Administer prophylactic eye medication within 1 hour of birth to prevent ophthalmia neonatorum. Cord care should be performed, keeping the umbilical cord clean and dry until it falls off naturally.
F.
Metabolic system and gastrointestinal system. 1. Digestive capacity. Newborns can digest simple carbohydrates but lack the enzymes to digest fats adequately. Their protein digestion is also incomplete. 2. Feeding and reflux. Feed the newborn frequently and assist with breastfeeding or bottle feeding as needed. Observe for signs of regurgitation or vomiting and burp the baby during and after feedings. 3. Stool types. The newborn stool typically progresses from meconium, greenish-black and sticky, to transitional, greenish-brown, and then to seedy, yellow stools in breastfed infants or pale yellow stools in formula-fed infants. 4. Newborn screening. Perform necessary screenings, such as for phenylketonuria PKU, before discharge after the baby has had adequate protein intake. G. Neurological system. 1. Head size and myelination. Newborns have larger heads in proportion to their bodies. Myelination of nerve fibers is incomplete, and primitive reflexes such as rooting and sucking are present. 2. Assess for abnormal movements. Look for symmetry in posture and movement. Jitteriness, tremors, or seizures should be documented and assessed further. 3. Assess reflexes and cry. Test the newborn's reflexes, such as the Moro and rooting reflex. A high-pitched cry may indicate neurological concerns. H. Thermal regulatory system. 1. Prevent cold stress. Newborns are prone to cold stress as they cannot shiver to generate heat. Ensure they are kept warm with proper clothing and environment settings. 2. Heat loss mechanisms. Prevent heat loss through evaporation, radiation, convection, and conduction by keeping the newborn dry and wrapped in warm blankets away from cold surfaces and drafts. 3. Monitor temperature regularly. Take the newborn's axillary temperature every 30 minutes for the first 2 hours of life, then every 4 hours for the next 24 hours.